Good evening, everyone. First of all, I want to thank Simpler Division for giving the opportunity of talking this topic, pedal edema and chronic kidney disease, and pertaining to mainly causes, symptoms, and the treatment. So today we will be discussing about chronic kidney disease or CKD and its association with pedal edema, along with its causes, symptoms, and treatment. So let's see what is chronic kidney disease first. It is nothing but continuing and permanent degeneration of the kidneys, which is known as chronic kidney disease. As we know, kidneys are the vital organs in the human body. They serve a variety of purposes, including the maintaining the body's mineral and electrolyte balance, assisting in the hemoglobin or red blood cell production, maintaining the acid-base balance of the body, and excretion of various uremic solutes like urea and creatinine and other waste products. So when the kidneys are damaged, they lose their capacity to execute these functions. So when you say chronic kidney disease, we divide them into various stages. That is stage 1 to stage 5. Stage 1 is the one where the CKD, where the GFR is normal or glomerular filtration rate is normal. Stage 2 is the CKD, where the kidney function decreases and the GFR falls from 90 ml to 60 ml per minute. Stage 3 is the CKD, where the GFR falls further from 60 ml to 30 ml. Stage 4 is the one where the CKD, where the GFR falls between 15 to 29 ml per minute. And stage 5 is the CKD when the GFR is less than 15 ml per minute. We call individual is having end stage renal disease when some form of renal replacement therapy is required for survival of the individual in the form of either dialysis, which may be hemodialysis or peritoneal dialysis, or transplantation, so that the individual will be able to survive. That is the one we call as an end stage renal disease. So kidneys can compensate for many of these functions. Once the kidneys function is lost, they present with variety of symptoms depending on the severity, like swelling of the feet and ankles. We say it as pedal edema, presence of nausea and vomiting, lack of appetite or reduced appetite, sleep disturbances like unable to sleep, urinary problem may be in the form of more frequently passing of urine, or they can have something called as reduced urine output. They have altered mental status like irritability, what you can call as unable to concentrate, cramps of the muscles, especially in the night time, high blood pressure because of the salt and water retention, shortness of breath because of anemia or because of fluid accumulation in the lung. We call it as pulmonary edema. All these are the manifestation of chronic kidney disease. As we have seen, one of the manifestation of CKD is pedal edema or swollen feet or ankles. So we'll discuss what is this about pedal edema. Pedal edema is nothing but swelling of the feet and ankles, which is caused by abnormal accumulation of the fluid in the ankles, feet, and lower legs. This edema or what we call swelling of the feet can be caused by two different mechanisms. One is because of what we can call as heavy loss of protein in the urine, or it could be because of impaired kidney function. In heavy loss of the protein, that is proteinuria can cause significant loss of protein in the urine and decrease in the protein in the blood, which can result in sensing of the body as reduction in the fluid volume, which causes kidneys to retain more and more fluid, which can cause in the form of accumulation of the fluid in the tissues, resulting in the edema. Or it can happen also in other way. Impaired kidney function can lead to retention of this what we call as urea, creatinine, along with that other various what we can call salt and water, which can also cause edema. So these are the two mechanisms which can lead to edema in a case of chronic kidney disease. So the symptoms of pedal edema include swelling or puffiness of the tissue just beneath the skin, as I mentioned. They also present like shiny or stretchy skin. Skin will become shiny when there is a accumulation of the fluid beneath the skin, or they can have accumulation which can be detected by pressing or giving the thumb pressing, what you can call as it can see appreciate the pits after being pressed for several seconds. So this is about chronic kidney disease. What are the symptoms? What is about pedal edema? What are the causes of pedal edema? And how do you diagnose pedal edema? Now let's discuss how to manage a case of pedal edema in terms of general management. how we can manage a case of pedal edema. So treatment includes mainly underlying cause, like what is the cause, you need to treat it. Other treatment modalities include salt restriction or salt reduction, and using the diuretics, the drugs which can eliminate the excess fluid in the urine so that the edema can be reduced. And last approach will be using of the compression stockings and elevation of the legs. Each of these modalities we'll discuss one by one. First one, salt intake. As we know, edema can be exacerbated by increased salt intake, because increased salt intake causes retention of the water, because along with that water will be also retained, and this can cause edema. So how to manage this? Reduce the salt intake, and an individual usually consumes around 6 grams or more salt. So you advise this kind of patients reduction in the salt in the form of around 2 grams per day, so that edema can be minimized. This is especially important when the individual is having already using diuretic, because the diuretic response will be minimal if the individual consumes good amount of salt. Along with that, water will also be consumed. So reduction of salt is important, along with that, especially in the diuretic usage. Coming to other modality of treatment, diuretics. Diuretics are the drugs which induce the kidneys to eliminate the more water and salt, hence reducing the edema. These are the one which can be used whenever there is accumulation of the fluid, because eliminating too much fluid rapidly sometimes can cause blood pressure variation and can cause lightheadedness. So you should use them judiciously and increase the dose as per the need of the individual. So what are the drugs which will be using? To mention few, we are using something called as torsemide, something called as furosemide. These are the commonly used drugs which will be using. There are other drugs also, like potassium sparing diuretics like spironolactone, which can be used to excrete the water and the relief for edema. So after using diuretic, you may need to empty bladder regularly. That should be understood, because individual may not feel comfortable why he is passing so much of urine after taking a particular medicine. This is the expected effect when individual can have can pass good amount of urine. That is an expected thing. So you should not be worried about that. So whenever the diuretics are used at the prescribed dose, you should always see for adverse effects, and if they are there, you should manage. Like when you are using diuretics, they can have electrolyte imbalance, like in the form of low sodium, hyponatremia or hypernatremia. They can have other side effects in the form of potassium sparing diuretics can cause hyperkalemia, which can also be life threatening. So this is how you should use diuretics. Use cautiously and judiciously and avoid the side effects. Next modality is compression stockings. This can also be used to both prevent and treat the leg edema. They are a good measure, and stocking should be used according to the individual size and avoid the discomfort, because they can cause sometimes skin irritation. So especially they are helpful when they are used along with limb elevating measures. So body positioning is the one more modality where you will allow the individuals to elevate the legs above the heart level so that the limb edema can be addressed. So these are the modality. One is usage of restriction of the salt, usage of diuretics, compression stockings, and body positioning. These are the methods of treatment of limb edema. So lastly, it is not always possible to treat completely CKD. So prevention is the best. So before that also, whenever the high risk individuals are there, like diabetes patient or individuals with high blood pressure, you should advise them to follow appropriate measures so that the CKD can be prevented. So if you are high risk, regular testing is important for diabetes and adequate control of the blood pressure so that the CKD emergence can be prevented. If already CKD is there, so detect it early so that you can prevent the progression or slow the progression of the disease. So limiting the salt intake, choosing the foods with low potassium, having the physical activity can reduce the edema, and that is caused by CKD. Thank you.